If you are over 60 and the very first thing you do every morning before breakfast, before coffee, sometimes before you are even fully awake is reach for your blood pressure pill, I need you to stop and watch this, because that habit, the one your doctor may have mentioned only once and you have followed every single day, since could be working against your heart instead of protecting it. I know that sounds alarming. It should. Not because I want to scare you, but because what I am about to share with you is backed by research that most patients never hear about in a standard 10-minute doctor's appointment. Hi, I am Dr. Ayla, and if what I just described sounds like your morning routine, then this video was made specifically for you, not for everyone. For you, stay with me because in the next few minutes I am going to walk you through something that could genuinely change how well your medication actually works. Now, a study out of the United Kingdom, one that followed over 19,000 patients, found something that quietly shocked the cardiology world. It found that the timing of when you take your blood pressure medication matters just as much as the medication itself. People who took their pill at the wrong time of day had measurably worse cardiovascular outcomes than those who took it at the right time. Same drug, same dose, different time, very different results. So the question you should be asking right now is, am I one of those people? Let me paint a picture for you. Imagine this. You wake up at 6 in the morning. You feel a little groggy, maybe slightly dizzy the way a lot of people over 60 do first thing. You take your BP pill with a small sip of water. You think, good, I have done my job for the day. But inside your body, something very different is happening. Your blood pressure at that exact moment is already beginning to rise naturally because of a built-in biological process your body runs every single morning without asking your permission. And instead of your medication catching that rise at the right moment, it is hitting your system at a time when your body is least prepared to use it efficiently. That process has a name. It is called your circadian rhythm. And once you understand how it connects to your blood pressure, you will never think about your medication the same way again. Here is what your circadian rhythm actually does. Think of it as your body's internal 24-hour clock it controls when you sleep, when you wake. When your hormones rise and fall, and yes, when your blood pressure naturally peaks and dips throughout the day, this is not optional. This is biology, and it runs on a schedule whether you are aware of it or not. Now here is where it gets important. For most adults, and especially for seniors, blood pressure follows a very predictable pattern throughout the day. It is at its lowest point while you are asleep. Then, in the early morning hours, somewhere between 6 and a.m., it begins to climb. This is called the morning surge. And for people over 60, this morning surge is not gentle. It can be sharp, significant, and for those with existing heart or artery concerns, it is the most dangerous window of the entire day. In fact, research has consistently shown that the highest risk period for heart attacks and strokes is between a.m. and noon. Not randomly, specifically because of this morning surge in blood pressure. Your body is waking up, your stress hormone cortisol is spiking to give you energy, your heart rate is climbing, and your blood vessels are tightening. All of this is normal. All of this is your circadian rhythm doing exactly what it was designed to do. But now let me ask you something, and I genuinely want you to think about this for a moment. If your blood pressure is already surging upward in the morning, and your medication takes anywhere from 30 minutes to 2 hours to fully absorb and activate in your bloodstream, is a pill taken at a.m. actually protecting you during that dangerous morning window? Or is it arriving too late to the situation? This is the question that researchers began asking, and the answers they found were uncomfortable. Now I want to be clear here because this is important, and I never want you to walk away from one of my videos with incomplete information. Not all blood pressure medications work the same way. There are different classes: ACE inhibitors, ARBs, beta blockers, calcium channel blockers, diuretics, and each one interacts with your body's rhythm a little differently. Some are designed to work best when taken in the morning. Others, based on the latest evidence, appear to work significantly better when taken at night, and some need to be timed around your meals, your activity, or other medications you may be taking. This is not a one-size-fits-all answer, but there is a direction the evidence is pointing toward, and I am going to share it with you clearly and honestly, the way I would if you were sitting in my office right now. Do me a favor at this point in the video. If this is already making you think differently about your routine, save this video so you can come back to it. Share it with someone in your family who is also managing blood pressure, because this is exactly the kind of information that gets lost between doctor visits and that people genuinely need to hear. Now let us talk about cortisol, because this hormone is at the center of everything we are discussing, and most people have heard the word but have no idea what it actually does inside the body. Cortisol is often called the stress hormone, but that label is a little unfair. Yes, cortisol rises when you are under stress, but it also rises every single morning as a completely natural and necessary part of waking up. It is your body's way of saying time to get moving, time to be alert, time to function. The problem is that cortisol also causes your blood vessels to constrict and your heart to work harder, which is fine in small, controlled amounts. But for someone whose arteries are already under strain from years of high blood pressure, that morning cortisol spike is like pressing harder on a system that is already under pressure. And here is something that very few people know, something that genuinely surprised me when I first studied this research closely. cortisol does not just affect your blood pressure directly. It also affects how well your blood pressure medication is absorbed. When cortisol is high, your digestive system actually slows down. Blood flow is redirected away from your gut and toward your muscles and heart because your body thinks it needs to be ready to move, to react, to perform. This is ancient survival biology running inside a modern human body. What that means practically is this. When you take your blood pressure pill first thing in the morning, during that cortisol peak, your gut may not be absorbing it as efficiently as it would at another time of day. The pill is there, the intention is right, but the biological environment inside your body at that moment is not optimized. For absorption, you may be getting less of the medication's benefit than you think simply because of when you are taking it. Now I want to introduce you to a landmark study because I think it will make everything we have discussed so far feel very real. The HYGIA Chronotherapy Trial. This was a large, carefully designed Spanish study that followed nearly 20,000 patients with high blood pressure over several years. Half of the patients took their medication in the morning as usual. The other half took the exact same medication, same drug, same dose at bedtime instead. The results were striking. The group that took their medication at bedtime had significantly better blood pressure control overnight and into the early morning hours, exactly during that dangerous morning surge window we talked about earlier. But more importantly, and this is the part that stopped cardiologists in their tracks, the bedtime group had nearly half the risk of heart attack, stroke, and cardiovascular death compared to the morning group. Let me say that again because I want it to land. Same medication, same dose, different timing, nearly half the cardiovascular risk. That is not a small difference. That is a result that should be part of every conversation between a doctor and a patient managing high blood pressure. Now, does this mean you should immediately switch to taking your pill at night? Not necessarily, and I want to be very careful here because this is your health and I am not your personal physician. What I am telling you is what the research says so that you can have an informed, specific conversation with your own doctor. The right time for your medication depends on which medication you are on, what your personal blood pressure pattern looks like throughout the day, whether you experience dizziness or lightheadedness at night, and several other individual factors. But here is what I do want you to take away from this section: timing is not a minor detail. It is not something to ignore or assume your doctor has already optimized. It is a real evidence-based variable that can significantly affect how well your treatment is actually working, and you deserve to know that. Have you ever noticed feeling dizzy or lightheaded shortly after taking your blood pressure pill in the morning? If that sounds familiar, I want you to write that in the comments right now, because that sensation, that wobbly, slightly faint feeling after your morning dose is actually a sign worth paying close attention to. It may be telling you something about your timing that your body has been trying to communicate for a while. Let us now talk about the different types of blood pressure medications because this is where things get very specific, and specific is exactly what you need. I am not going to overwhelm you with medical jargon. I am going to explain this the way I would explain it to a family member sitting across from me at a kitchen table. The first category is ACE inhibitors and ARBs. These are among the most commonly prescribed blood pressure medications in the world. Drugs like lisinopril, ramipril, losartan, and valsartan fall into this group. They work by relaxing your blood vessels and reducing the workload on your heart. Now, for many years, the standard advice was to take these in the morning. But current evidence, including the HYGIA trial we already discussed, strongly suggests that for most people, these medications perform better when taken at bedtime. Why? Because they work through the night precisely when your body needs protection against that early morning pressure surge that begins while you are still asleep. The second category is calcium channel blockers. Medications like amlodipine, nifedipine, and diltiazem. These relax the walls of your blood vessels by blocking calcium from entering the muscle cells that control vessel tightening. Amlodipine in particular has a very long half-life, meaning it stays active in your system for an extended period, which gives it more flexibility in timing. However, some studies suggest that even with long-acting calcium channel blockers, evening dosing provides slightly better overnight blood pressure control. The third category is beta blockers, medications like metoprolol, atenolol, and carvedilol. These slow your heart rate and reduce the force of your heart's contractions. They are often prescribed alongside another medication and are particularly important for people who have already had a heart event. Beta blockers tend to be more timing sensitive in terms of side effects. Some people experience fatigue or vivid dreams when they take them at night. For others, morning dosing causes more dizziness. This is a conversation that genuinely needs to happen between you and your prescribing doctor because the right time is highly individual here. The fourth category is diuretics, sometimes called water pills. Hydrochlorothiazide and furosemide are two common ones. These work by helping your kidneys flush excess fluid and sodium from your body, which reduces blood volume and therefore lowers pressure. Here is the practical reality with diuretics: most doctors and patients agree that morning is the better time for these, simply because taking them at night means multiple trips to the bathroom and disrupted sleep, by the way, is itself a significant driver of elevated blood pressure. So with diuretics, the lifestyle logic of morning dosing generally outweighs the chronotherapy argument. For nighttime, do you see the pattern here? There is no single universal answer, but there is a framework. And that framework is built around understanding how your specific medication interacts with your body's natural 24-hour rhythm. The worst thing you can do is assume that the timing on your prescription bottle is the result of careful chronotherapy research applied to your individual case. In most situations, it is simply the default, a starting point, not a final, optimized decision. Ask yourself this: when was the last time your doctor specifically asked you what time of day you take your blood pressure medication and how you feel in the hours that follow? If the answer is never, or you cannot remember, that is a conversation worth starting at your next appointment. You now have the knowledge to ask the right question.